Hi everyone, good morning. My name is Rob. And our will today is that everyone should have health insurance. And in modern society, we should spend more energy on disease that we are not aware of, emergencies that may occur at any time. So in our will, the government should force every citizen to buy and have a reliable medical treatment insurance, which is like insuring a car. Is that designed not to cause trouble for yourself and others. That's all.
Okay.
Okay, hello everyone. Good morning. I'm Jinren. I will represent our group to start our debate. Today, our topic is all taxpayers should be required to have health insurance in US. And our statement is we are against with it. As we all know, when you purchase anything you want, you need to pay tax. And however, do we have to get health insurance? I think the answer may be no. Um, Paying tax is the responsibility and the obligation of every person living in the United States. No matter we want to do it or not. What's more, test behavior appears in every aspect of our daily life. For this, we have to spend a lot of extra money. Therefore, it is not necessary for everyone to be required to have health insurance. And my point of view is that it will waste taxpayers' money. And on the one hand, just because you have health insurance, that doesn't mean you have access to use it. For example, if you bought health insurance for 2021, but your body had no problem throughout this whole year, that means you have no chance to use your insurance at all. So it's really wasting money. And on the other hand, even if you are sick and you can use the health insurance, that may not be a very good deal. Let me give another example. If you only have the tooth problem for the whole 2022, like the tooth decay, but which the health insurance can cover, then you come to the dental hospital and the doctor would tell you if you don't have health insurance, it may cost maybe just only $200 if you don't have health insurance. But however, even you have the health insurance, it can cover it. You may need to pay $2,000 to buy the insurance. It's not very good deal because you maybe only need to pay $200. But if you require for the insurance, it may be cost you $2,000. So, as we can know that the insurance, I think, is not necessary to be required for everyone. Thus, I want to stress again that taxpayers are required to have the health insurance. That's really not a good idea because it doesn't work in every situation for everyone. Moreover, in many cases, the health insurance not only does not work, but also waste a lot of the taxpayers' money. Okay, that's my opinion. Thank you.
Great, thank you, Jinrun. Okay, so now we've finished our intros on both sides, and we'll move on to the rebuttal. So on team one, who wants to?
No, we don't finish
intro, I guess there's only one topic.
Yeah,
this
then
one,
they
and
will
I give the
ask
another two
questions.
topic.
Oh, you have
Yeah.
more to say for the intro?
Yeah.
Okay, so then,
Oh.
okay, wait, so on this side, do you have anything else to say for the intro?
No,
Okay,
you win.
so then Needy, you can go ahead.
Okay. Hello everyone, good morning. I have against of the health insurance. So my topic is health insurance is very expensive. The most significant downside of private health insurance, as you might think, it is the expense. This is especially true if you are in the bad health and lack access to any type of group covers. Individually policy can cost $100 per month, and family covers can be significantly more expensive. Even the most comprehensive insurance include debited and copies that must be made before covers in activated. The majority of health insurance policy do not cover all disease and disorders when it comes to paying for some medical service. Those who require care that fall within one of the gaps in this policy are on their own. Furthermore, healthcare costs have risen at a considerably quicker rate than the overall rate of inflammation, and this trend show one sign of abating. Everyone, sick or well, is affected by the rising expense of healthcare. It has been stifling individual spending power for decades. Salary for American employees have risen, but net income has remained unchanged due to rising healthcare costs. To assist stretch medical and hospital resources to deal with the overall system demand, it is critical to cut back on overspending now. And I give you one example. We are student and we have university health insurance through United Health Insurance Company. For international students, this insurance is required. Each semester we must pay $1,200. This is highly costly indicator for us. In addition, we must pay $15 for each hospital visit as well as various fees for blood tests and other medications. Everyone know I underwent a little operation in January. As a result, they issue me with a fourth bill for that surgery. They send me a new bill every time, and the latest bill I received was for $160. It is incredibly priced for students. So the health insurance for us so expensive. Thank you.
Thank you, Needy.
No, it's their turn. Yeah, it's just
Okay, so is this everything you wanted to say for the intro? Okay.
Hello everyone, I'm Chen. So today, before I discussion this topic, I need to give you one point is the health is bigger than money. It is like the health insurance is very expensive, but I don't think so. Medical care in America is so expensive. So so everyone has a different necessary for the health. So if you get a sick, you need to drink probably you need to drink a lot of the imported medicine, like the China medicine or the Kingdom medicine. Probably we don't know. But this medicine, imported medicine, is very expensive. If the government not to cover this medicine, you need to pay a lot of money. And for any country, the poor people is occupied a lot of the people. I mean, the rich man just a little part of the people. So we should pay the if we enjoy the preferential treatment of the state, so we should pay medical insurance. And medical treatment insurance gives the help on economic economy to the labor of seeking conduce to eliminate the social instability factor that brings because of the disease. It's important social materialism that adjusts social relation and social contradiction. So if you without the money you can earn, but you without the life there is nothing. And I need to explain the insurance. So insurance transfer the Chinese is means 保险. You don't know what is the Chinese means. It's 保险 is the transportation. But this is means you need to insure against the future thing. So who knows the tomorrow and the sick who is what is coming the first. So we need to prefer the medical insurance. So, thank you.
Great, thank you, Chun.
Good job.
Okay, so team 1, was there anything else you wanted to say for the rebuttal?
What?
Anything else?
Mm,
Question.
Yeah, do you have questions for the other team?
so,
So so if you think the insurance medicine, you don't need to. This is very not necessary. So do you think what do we do if you get the sick? What do we do? You just pay a lot of money.
Okay, I answer this question. Our point is that it is not necessary for us to be required for the insurance for the every taxpayers. It is that means that we can choose another company, the insurance company. That means if you have sick, of course you can have the insurance, but it not be necessary.
Does it change the another company?
Yeah, we can change. It is not forced by the government, but we can choose another company. Like if these whole years I have nothing, my problem is not. I can choose not buy it because this choose is up to me, not be forced by the government. And I can, if I need, I can choose to buy another company for the insurance because maybe the government's insurance cannot cover all the health problem. Like what I say, if you have the tooth decay, but the dentist is not covered in the insurance, then we can choose another company. So it's that what I want to say is that it's not necessary for us to be required by the government to buy the health insurance. Yeah.
So we can debate or we are next.
Great, so yeah, if you do you have any other questions for team 2? Any other questions?
no questions.
No questions. Okay, so then team 2.
We ask question. Or
Yeah, so you will give your rebuttal and then you'll ask your questions.
So
Okay, I want to ask another question. Is that we think the insurance is
unaffordable for everyone.
unaffordable for everyone, like some very poor person or like some students in the university, it cannot afford the
Health insurance.
the money of them. So if it is required for everyone, that is not fair for this kind of people because they not have enough money even for their daily life. So they cannot give other extra money for the health insurance. So for that situation, maybe
What to do for this situation?
I got some answer. So you said the insurance is not